Hi, I am Amit Lunkad. In this video, we discuss about the calcium channel blockers. Calcium channel blockers are also known as calcium channel antagonists or simply calcium antagonists. These are a group of medications that disrupt the movement of calcium through calcium channel. Calcium channel blockers are used as antihypertensive agent, anti-anginal agent, as well as antiarrhythmic agent. In this video, we discussed in detail about which are the different types of calcium channels and the different classification of calcium channel blockers. Let's begin with the what is calcium channel blockers or calcium channel antagonists. As all of you know, calcium ions play an important role in the regulation of many cellular processes. There are four types of calcium channels differing in location and function. So, which are those types? So, first type of calcium channel is L type, which is located in skeletal, cardiac, and smooth muscles, causing contraction of muscle cells. Second type is T type, which is found in pacemaker cells, causing calcium entry inactivated at more negative potentials and more rapidly than L type. Next one is a N type, which is found in neurons and acting in transmitter release. And last one is a P type, which is located in Purkinje cells but whose function is unknown at this time. So all this type of calcium channel, which is a voltage gated channel. Calcium channel antagonists, which act only on L-type channel to produce their pharmacological effect. Calcium channel blockers acted on this L-type calcium channel consist of five different subunits, which is designated as alpha 1, alpha 2, beta, gamma, and delta. The alpha subunit which provide the central pore of the channel and through which there is a entry of calcium occur. So here is this schematic representation of an L-type calcium channel. The calcium channel blockers can be divided conveniently into three different chemical classes of the prototype drugs that have been used. So these classes of beta blockers are: first class is phenylalkylamines, example verapamil. Second class is 1,4-dihydropyridines, example nifedipine, and benzodiazepines, example diltiazem. These prototype compounds sometimes are termed first generation of calcium channel blockers because two of the group of drug classes have been expanded by the introduction of a second generation of more potent analogs. So in next we see which are the examples of second generation calcium channel blockers. So the first class is phenylalkylamines, and we just now seen first generation drug is verapamil and second generation drugs are anipamil, bipridil. Next chemical class is 1,4-dihydropyridine. Example of first generation is nifedipine and second generation drugs are amlodipine, felodipine, isradipine, nimodipine, nicardipine. And last chemical class is benzodiazepines, which only have a first generation drug which is diltiazem. So important things regarding calcium channel blockers. The specific calcium channel antagonists like verapamil, nifedipine, and diltiazem interact at specific site on calcium channel protein. These blockers do not occlude the channel physically but bind to sites in the channel as they can promote both channel activation and antagonism. The channel can exist in either an open, resting, or inactivated state, and the equilibrium between them is determined by stimulus frequency and membrane potential. Here is the schematic representation of an ion channel existing in an equilibrium of resting, open, and inactivated states. Verapamil and diltiazem do not bind to a channel in resting state. Only after the channel has opened, then they will get binds to that channel. They are ionized, become water soluble, and calcium entry blockers that reach their binding site by the hydrophilic pathway when channel is open. Nifedipine is a neutral molecule at physiological pH and can cause interference with the calcium in the open or closed state. In closed state, nifedipine can traverse the phospholipid bilayer to reach its binding site because of its lipid solubility. So this important point you have to remember. Verapamil and diltiazem binds to the channel in open state, whereas nifedipine can bind in closed or in open state. Now here we discuss the structure of these prototype calcium channel blockers. First is the verapamil. Here is the structure of verapamil. The class of verapamil is diphenyl alkylamine. The verapamil used in treatment of angina pectoris arrhythmias from ischemic myocardial syndrome, and it is also used in supraventricular arrhythmias. Second one is the nifedipine, which is the example of 1,4-dihydropyridine. Here is the structure with its IUPAC nomenclature. Nifedipine is more effective in patients whose anginal episodes are due to coronary vasospasm and is used in the treatment of vasospastic angina as well as classic angina pectoris. It is used in selected patients to treat hypertension because of its strong vasodilatory properties. And last one is the diltiazem, which is a chemical class is benzodiazepines. The structure of diltiazem with IUPAC nomenclature. Diltiazem used in clinically similar treatment condition as an antiarrhythmic agent, but is less potent. Here we discuss about the different types of calcium channels, classification of calcium channel blockers, and structure of prototype calcium channel blockers. Hope all of you getting. Thank you. Happy learning.